Across the country, as many as 4,500 persons are living with HIV/AIDS, making its prevalence in Belize one of the highest within the region. Despite a systematic effort by the National AIDS Commission to educate and inform about the ravages of this illness, many are still engaged in risky sexual behavior.
Last year, the Ministry of Health reported over 30,000 HIV tests done. Of those numbers, we have 223 new infections, which may not seem like a lot for a country like Belize. However, it's considerably high. It is estimated that there are 4,500 persons living with HIV and AIDS in Belize. And we have a prevalence rate of 1.9%. So that is one of the highest rates in the region. There were also 108 deaths related to HIV and AIDS. That is unacceptable given the fact that the government of Belize provides anti-retroviral medication free of cost to patients. However, we must be cognizant also that one of the biggest deterrents for testing and accessing health care is the whole issue of stigma and discrimination.
House Speaker Laura Longsworth, who is also chair of the National AIDS Commission, has spoken on the issue of stigma and discrimination.
People with HIV/AIDS are really stigmatized. If some people are thrown out of their homes, some people are ashamed because if people know that they are HIV positive, they will talk about them, and so they don't take their treatment. Our problem is really one of a people problem. We've got to be more friendly to our people. We have to remember that it's a human rights issue.
December 1st is celebrated annually as World AIDS Day. This year, it is the 30th anniversary of a pioneering global health campaign, first initiated by the World Health Organization in 1988. The focus is to urge people to know their HIV infection status through testing and to access HIV prevention, treatment, and care services.
What we have done, apart from the usual testing that is taking place countrywide, we have decided to give back to organizations that are working directly with persons living with HIV and AIDS. So what we did, we collaborated with some private enterprises, specifically Grace Kennedy Belize Limited, Santiago Castillo Limited, the Ramada Hotel, as well as Human Development, in putting together nutritional packages that we are handing over this morning to organizations, like I said, who work with persons living with HIV and AIDS.
So where is Belize in the fight against AIDS? There is currently a move to urge local policymakers to promote a Health for All agenda for HIV and related health services.
Belize is very much on track. We have anti-retrovirals free of cost. We have services free of cost. We have health services free of cost. We have mentoring services, and we've also been paying keen attention to our key populations, men who have sex with men and so on, because we have to open up that environment. We have to remove it from the personal problem that we have with key populations and move it into a setting where it's a human rights setting. And we also have to worry about our children. We have a few children living with HIV. If we don't set the stage for them when they are 16 and 18 and it's time for them to look after their own medication, they will also not take their medication and they're going to die.
Reporting for News 5, I am Isani Cayetano.